Giano, one of the course directors from Mayo, Arizona. And just a few announcements. Please remember to turn in your evaluations, or at least do them, and we'll collect them. We use them every year to formulate next year's course. The second one is that if anybody's using self-parking, there's validation at the registration desk. So we're going to start off this morning with Dr. Gus Lee, who's a good friend. He's at Mayo Clinic, Jacksonville. He truly does all three of Mayo's shields. He's an outstanding clinician. He's a great educator, and he does phenomenal clinical research also. Today he's going to talk about one of his major interests, which are aspiration syndromes, and we'll kick off the morning with Dr. Lee. Gus?
All right, good morning. Like I start out every morning, I'm going to read you a Trump tweet. I'm just kidding, yeah. So aspiration is actually I've done this talk in many different ways. You could consider it a disease, but it's really not. It's not really a syndrome, really. It's a class and group of diseases. It's what it really represents, and what I want to hammer home by the end of the day is thinking about the mechanism, that aspiration is a mechanism for a variety of things that we encounter both commonly as well as uncommonly. So I'm going to do it case by case and then kind of draw out the aspiration aspect of each of these clinical situations. So this is not an uncommon situation for those of you who work in the ICU, where you get a code blue. We ran down and we saw this patient who was cyanotic, unresponsive, emesis, fecal emesis, pooling out. This patient apparently had a bowel obstruction. Resuscitated the patient, secured the airway, and at that time we were doing a study where we were measuring pepsin, which, if you recall, is a gastric enzyme, from the airway sample, and tremendous amount of pepsin had ended up in the lungs in the BAL specimen, pepsin and BAL of 220,000 nanograms. So really you should have very little or none of pepsin in the airways. And so this patient's x-ray, as you might expect, within a few hours, right? So what do we call this? We don't say aspiration per se, we say ARDS. This patient already has a tube. You can see the tube. It's got a central line. You can see he's got a lot of comorbidities with AICD and pacemaker in place. And what we learned over time, and we've known this since Tom Petty first described ARDS, or one of the original